Ensuring wellness in the community is more than just providing quality health care to the patients. The community wellness team at TidalHealth knows that, and it's why they advocate to connect people to so much more. Medical equipment, transportation, health education. That just names a few. So here to tell us even more about this important mission, Rodgers, the Director of Community Health Initiatives with TidalHealth. Thank you so much for being here this afternoon.
Thanks for having me.
So the community wellness team, what is that?
So we used to have a team just based in Salisbury, and over the winter we've built up a team to serve Sussex County.
Oh, wow.
It's part of our population health division at TidalHealth.
So how do they coordinate with local leaders to accomplish what you're after?
Well, we have a team with a nurse practitioner who just joined our team, 3 community health workers, and a part-time registered nurse. And together, they're going out into the community. They might be seeing patients in their homes who are at risk for coming back to the hospital, or they might just be doing outreach, education, screening, all through community partners to improve access and help us have a thriving, healthier community.
So they've got all kinds of resources.
Yeah, we're using a lot of different tools. It's all about building trust and understanding what's already in the community and how we can connect people to community-based resources.
Okay, what about the marginalized? That is such a big fancy word. What about the hard-to-reach community on the fringes?
Well, a lot of areas don't have internet, right? And a lot of people we know especially Western Sussex, don't have transportation. They might not have easy access to food, or there might be financial strain. So we're assessing all of our patients for also housing factors. And if somebody has an issue, an insecurity, some sort of need, then we're going to where they are. We're meeting people where they are, and that's how you reach what people call marginalized communities. It's really places and people who are under-resourced, who don't have the supports they need to live their optimal, healthy life.
So, it's a hard question to ask. Does literacy come into play in all of this?
Absolutely. If people don't, there's a difference between literacy and education and health literacy.
Okay.
So health literacy means that somebody can receive information and act on it to improve their health.
Right.
So our nurses are very proficient in providing health education, so are our community health workers. Actually, they're working toward a certification in health literacy. So they're working with patients one-on-one, but then we're also trying to bring those supports through the library system and create Wellness Wednesdays once a month at the Laurel Library, and do different strategies like that to help people understand how to take care of themselves.
This is absolutely incredible. It's a wonderful, I hate to call it a project, but I mean the inner involvement in the community as well. So that brings me to this question. Have you got plans for the future?
Yeah, so this is a growing segment of healthcare to really do community integrated approaches and be outside of the hospital and build trust and work within the community. So we're doing a lot of prevention and screening, education and outreach right now, but we want to do more clinical things out in the community with our new Wagner Wellness mobile units. We want to actually be able to draw blood, test people's A1Cs, test their cholesterol levels, and use that information. So we're hoping to be able to start that up very soon as well.
So they're not on the road yet, but soon.
We are on the road, but it's
it's
mostly prevention and education, and we want to be able to draw labs and give people who can't get to a lab more information, more data about their blood work and what's going on.
Are you just a little bit excited about this?
Very excited.
It is amazing.
Yeah.
Wow. Rodgers with TidalHealth, thank you so much for stopping by this afternoon to explain all that.
Thank you.
That's amazing.